briefing for Thailand team ครับผม Thank you Stephanie
Thank you, Wayne. Sawadika, everybody. Sawadika, Dr. Alaric. How are you
Yes,
doing?
สวัสดี Hi, Stephanie.
I see Kunpat as well. So let me give you a brief introduction. My name is Stephanie. I am the Customer Success Manager for Elsevier Health Southeast Asia. And today we'll be doing a bit of a product presentation for Clinical Key AI. So without further ado, I will start to share my screen. I will go through an introduction first, a slide deck, and then I'll bring us into Clinical Key AI and I can show you the platform itself. At any point, if there are any questions or if I go too fast, please let me know. Feel free to come off mute or drop any comments or feedback or questions in the chat. Win, I'll need your help to have a look at the chat while I present because I only have one screen, so I'm not able to see the chats as I go along. And
Okay
thanks, Win. So let me quickly start to share my screen and try to present this in. It's my deck. Deck.
Yes. Okay, now I can see your screen.
Okay, wonderful. Thank you so much, Dr. O. So, just starting off today regarding clinical key and clinical key AI is that we do know that clinicians are, there's no shortage in terms of clinical information, right? Anywhere you go, not even the trusted sources that you have, which is clinical key, you have from Google as well. There is so much information that a clinician has to take. Sorry, I'm not sure that I'm sharing this as a deck. Okay, there we go. There's so much information that you have to view, you have to sift through in the care of your patients. And not only that, you are facing a changing environment where there is a higher cognitive load. And what we mean by that is that a lot of times you are faced with patients who are coming to you not only with a single medical condition, they come with a lot of comorbidities, right? They also come with maybe polypharmacy conditions where they are taking 2 or 3 different medications. And you as a clinician, you have to juggle the decision on how you're going to prescribe certain medications, whether there's going to be adverse reactions, whether there's going to be drug-drug interactions. So there is a higher requirement for you to take into account a lot of different aspects of your patient care. And not only that, when patients come to you with more comorbidities, more different ailments, you spend a lot more time investigating in terms of checking the drug-drug interactions, checking through the different drugs within a drug class, also what sorts of treatments that you might consider for your patient in terms of the different medical conditions that they have, right? Perhaps if they have diabetes, you might need to think about how you're going to treat them, maybe for their glaucoma or even their hypertension, etc. And there is also an unfulfilled potential of AI. A lot of times we see that AI is here to help us, right? We use it, I think, even now on a daily basis, whether we are using ChatGPT to summarize our notes, whether it is to summarize, getting quick information, there is a potential for AI to assist in the daily activities. However, sure I can go to the next page. Now, however, there is a challenge in terms of accessing all this information and getting to the information that you want. In the initial search, a lot of times there are fragmented sources and constant interruptions. I know that you are very busy as clinicians, right? You are seeing patients on a daily basis in your clinics, and in between, you may have nurses coming to you with maybe reports from other patients as well. And as you're trying to look for the information, as I said, fragmented resources, are you only looking at perhaps using clinical key, which Elsevier is providing to a lot of the hospitals in Thailand and the medical institutions? Or are you even looking at, for example, the local guidelines? Are you looking at international guidelines, international journals, or even maybe just doing a quick Google search? So the information source that you are referring to is fragmented, and that causes you to lose a lot of time, right? And from a expert perspective, there are ad hoc consultations as well. You may not be the expert in a different specialty, right? You are experts in your own specialty. You may need to do a quick consultation with your colleagues as well. You might pick up the phone and say, hey, I have this pediatric patient. I'm not very familiar with nephrology. Can I ask you a question? So again, you are looking at not only the formal information in terms of sources, but also informal perspectives from your peers and your colleagues as well. You also might do online research, maybe non-clinical type of AI. As I said, the one that we all know the most is ChatGPT, which is a large language model. And the one thing we have to remember about large language models is that a lot of times the way that they have been developed is that they will provide to you the next most likely word. So if you type diabetes, the next most likely word is mellitus, and then type 2, etc., etc. So it may not come from a medical perspective. It comes from a language perspective. So in that way, there is this question on how extensive and how reliable the information that we have. And we also see a lot of large language models out there. They may be outdated in terms of the information that they provide, because it all depends on when was the last index date or when it was last indexed. So the information may not be as updated as you would like it to be. Now, as covering all that, so for you to find a clinical answer to a question that you have regarding your patient care, it might take you up to 32 minutes. And that is a lot of time for you in a day, on a daily basis for each and every patient, right? So moving on, there is also some cost involved that we're talking about, right? So when you have an overload of patients, when you have an overload of information, it causes frustration. As I said, there's 32 minutes per patient, and you may or may not even get to the answers that you want within that time frame, right? So that causes a lot of frustration. And we also see that there will be a lot of people who experience burnout in the medical field. And so when your peers or your colleagues leave, there may be a gap in between the time that they are replaced. So in that time frame, you would have to take on additional responsibilities and cover for them before a replacement is found. And again, that causes further frustration because you have a lot more on your plate that you have to do right now. And everybody only has 24 hours. So you don't really have enough time to address all the sorts of obstacles and issues that you might have. And this will impact quality of care for your patients, because there is a possibility that you start rushing through each case. You may not make the full consideration because, again, it comes to the restraints that you have. It is through no fault of your own. It is the burdens that you have. It is all the different obstacles that you are facing. And poorer quality of care may potentially end up to affect your reputation or the reputation of your hospitals as well, right? So we want to avoid that, because at the end of the day, we know that you are all very good clinicians, right? But we do not want the restraints of time, the constraints of the availability of information that is available to you to cause the quality of care to affect your reputation and your institution's reputations as well. Now, covering all that, because of the restrictions that you have, almost 60% of clinical questions go unanswered. And this is from a study by Delphiol. The source is at the bottom for you to refer to. Okay. And moving forward. Okay, so what we would want to try to address from the perspective of clinical key as well as clinical key AI is to assist you to distill the information so that you are still able to make the right decisions, the right clinical decisions, so that you're able to deliver timely evidence-based knowledge at the point of care. And we also want to, at the end of the day, bring the joy back to practice for you. All of you, I believe, would have come into the medical profession wanting to help people. You know, that brings you joy. That is, in a way, the whole reason why you came into medicine, right? You want to help people. You want to be able to contribute to society. So we want to bring that joy back to you. And of course, this will allow you to have higher confidence in making the clinical decisions that you have, that you need to make for your patients, as well as to increase the professional satisfaction on a day-to-day basis for you. Okay. So covering a little bit in terms of delivering timely evidence-based knowledge at the point of care, we are looking at time pressures on clinicians. As we say, you only have 24 hours in a day, and you are also seeing a higher load of patients and with more complexities as well. So the reason for clinical key AI to be here to assist you is that you would be able to ask questions as you would in an everyday conversation with a colleague or a peer of yours. You are able to get answers in the fraction of a time that you would if you were to have to look through multiple sources and different sources of information. Okay, and the most important thing, as well as always for Elsevier, is that the information that we provide to you, we want it to be trusted information, trusted content, so that you are able to base your decisions on summarized evidence backed by citations. So this is also one different factor that we have for clinical key AI, in the sense that all the information and the responses that are generated within clinical key AI is backed by citations. So you can look through all the different references and where we get this information for you to maybe either to double confirm or for you to do a deeper dive into the responses that you get. Clinical key AI as well accounts for patient complexity. And I will show this in the demonstration a little bit later, in the sense that you are able to contextualize your patient question. You can put in, blood pressure or vital signs or even ethnicity, because we know certain medical conditions, the treatments may be reliant on the ethnicity of the patient. How you would treat a white Caucasian patient could be different from how you would treat a Black African American or even an Asian, right? And even sources of the medical condition could be different. Looking at maybe if you were to say a fever and chills in a patient, if you are looking at a Western perspective, it could come as a flu. However, if we are looking at it from an Asian perspective, we could maybe consider malaria or dengue as well. And that is geographical context that we have to look at. And clinical key AI is also an intuitive clinical reasoning assistant. At the end of the day, it is here as a tool to support you in your clinical decisions. At the end of the day, you are still the final decision maker in terms of the treatment and care plan of your patients. So, in order for us to help you with the getting to the information much faster, this allows you more time to be doctors, for you to have that face-to-face interaction with your patient, for you to be able to interact with your patient, right? So this allows you more time to be the professional that you are. Okay, and we also hope to turbocharge your clinical decision-making process by shortening that amount of time that you need to provide in terms of searching for information. And so next one I want to cover is the content quality and reliability. As I have mentioned before, at Elsevier, our main purpose is to provide you with trusted content and the most trusted current evidence-based information there is, right? This allows you to turn into maybe a subspecialist 24/7 within the clinical overviews and the different topic overviews that we have. You are able to explore a variety of different disease conditions and medication alternatives. You are also able to base your decisions on the state-of-the-art clinical practices. As you already know, with Clinical Key, we index on a daily basis. We update on a daily basis. So that provides you with the most updated information and trusted as well. You are also able to investigate emerging treatments, because not only do we look in Clinical Key AI to the established practices, but we are also looking at journal publications as a content source as well. So you would be able to be exposed to the emerging treatments for the different medical conditions there are. Okay? And this provides you with comprehensive evidence-based content as well. Okay? So this will build with a sustainable culture in terms of better patient care and reduction of costs, because you will have most of the information that you require within one platform itself. Okay. So that is a little bit on the content quality and reliability. Now, one thing I want to do or touch on is in regards to unvetted AI. Now, there are more and more AI options coming available on the market, whether it is paid or free, right? Now, there is the question again of, how this AI is being used, and how would you be putting the information within these AI models, right? Now, as I said, right at the beginning, everyone is already using AI. It is no longer a question of when, right? Or how or if, right? Everybody is using AI. However, we do want to make it in a way, a controlled environment, because the AI that your team is using should be vetted, and it should mitigate against rogue use of information, right? You need to have sensible guardrails when we use AI. Now, think about it this way. Earlier, I mentioned for CKAI that you are able to contextualize your patient in your patient case, for example, in terms of whether you are looking at maybe ethnicity, or put in the vital information, the vital signs information, etc. Now, think about it this way. If this is an AI model that is open to everybody, you risk exposing your patient information on those models, right? So you need to have an environment where there is sensible guardrails as well. And we want to also avoid biases when it comes to AI. So that is where Elsevier is coming with Clinical Key AI, in terms of providing you that AI environment, but within trusted content. And we look at it as responsible AI, right? That's where we are coming from. And in a way, as I covered earlier, you should be using a trustworthy AI solution in your daily use, right? And in your institutions as well. Okay. So that being said, I've been speaking a lot on all the different aspects. So why are we talking about Clinical Key AI? Again, we use trusted evidence-based clinical content, so you can trust the information that is coming to you from within the platform. In terms of savings of time, we provide you savings in time in terms of treatment recommendation as research as well. Ease of use. It is a simple conversational search tool that you can use almost immediately, right? If we open the trial for you today, you will be able to log in, go into the platform, and then start using it. It's a very simple way of using this tool, right? You don't need to go through a very long process to train. Only perhaps you might need to think about how you would do the prompting in the questions. And we'll cover that a little bit later on the actual demonstration itself. And in terms of responsibility, the generative AI is designed specifically for clinical application. So that we are looking at it from a medical perspective, not so much from a language perspective as I covered earlier. Okay, and it provides you with the expertise as well. You will have the ability to answer niche and complex questions in contextualized manner. So having said all that, I think the proof is in the pudding, shall we say, by looking at the Clinical Key AI platform itself. But before I jump into the platform, is there any questions regarding the deck that I just presented?
Yes, please. Please feel free to turn on your camera and ask Stephanie. She's here. I'm not sure anybody has the experience on the Clinical Key AI yet, because I think some people already have the registration from the Clinical Key AI already, but I'm not sure are they already use it or not. But I do have some experience on that, on the Clinical Key AI. That's very easy to use, very comprehensive answer. And as you said, it saved my time. But honestly, sometime the AI answer that, okay, I cannot answer this question. I have no idea maybe about the prompt, or even the information is not ready yet. So I think, but we have to learn together how to use that. But now I think there's no any questions. So please go on, Stephanie.
Thanks so much, Dr. O. And that's a perfect example, right? It does sometimes come to the way that we prompt, how we ask a question, right? That do we get the answers that we want, or do we get a different response? So that is there's a little bit of art when it comes to the prompting. And as rightly, as you said as well, certain questions that you ask, we are the first to say if the evidence is not strong enough for us to recommend a response in terms of treatment, we are the first to say we do not want to give you an answer for the sake of giving an answer, right? So that is, in a way, the responsible portion from Clinical Key AI as well. So if there is not strong enough evidence for us to give a response, we will rightly say so as well. And thank you for pointing that out. That's one of the very, very important things that we like to highlight as well. Okay, so quickly jumping into the platform. Okay. Now, before I go into Clinical Key AI, I just want to do a quick refresher on Clinical Key. I'm sure all of you are very familiar with Clinical Key already, but I just want to highlight a few things so that when we go into Clinical Key AI, you'll be able to see the difference, right? You'll be able to see why these two platforms are different but complementary to each other. So with Clinical Key AI, we've always mentioned that we provide you both depth and breadth of information, right? You are able to deepen your specialty and medical knowledge from the collection of medical reference books that we have here, as well as our collection of journals. We also have procedure videos that if you would like to see the latest evidence-based practices in terms of how different procedures are done, the actual procedure itself, there are videos available within Clinical Key here, right? And also in terms of informing your clinical decisions, we have the different clinical overviews. We have the drug monographs so that you can take a deeper look in the different drug treatments that you may be prescribing. Or as I said, when it comes to the cases where you have patients taking 2 or 3 different drugs, you may want to consider alternative prescriptions because of perhaps drug-drug interaction. So you may need to look at the entire drug class overview when it comes to selecting the right drug for you to prescribe to your patient, right? So we have all this wealth of information within Clinical Key already. Now, if you were to have a patient come to you with perhaps, and I type heart failure, for example, okay, I'm going to run a search on it. And you will see in terms of the results that I get, it's going to be quite extensive. There's going to be, I believe, if I'm not wrong, in terms of heart failure, there's 15,000 results when it comes to searching anything on heart failure. As usual, in the clinical overview, we will have the summary, the diagnosis, the workup, the treatments, everything here as well. Now, again, we come to the issue of patients with comorbidities. So this patient may have heart failure, and then you would have to read through the clinical overview for heart failure. Let's say they also have diabetes. Then in that case, you would have to search diabetes and read the clinical overview on diabetes. What if they have glaucoma, for example? Then in that sense, you would have to read 3 different clinical overviews, have that information, and then digest that information yourself, right? So you are, at the end of the day, being the one to absorb the information and then making your decision by looking through all these different resources that we have, right? So it is a little bit time consuming in that sense, especially when you take into consideration patients with complexity, right? If it is let's say a patient that perhaps with an emerging disease, for example, just recently we had the monkeypox, right? Mpox. So if you wanted to just have a quick look at what that medical condition was, then Clinical Key is perfect, right? You go into the clinical overview and you have an entire background of the medical condition, the treatments, as well as any sorts of diagnosis that you need. However, as I said, this is not going to be very helpful for you at the exact point of care when you have patients with different complexities, right? And this is how in this sense, I want to start to go into Clinical Key AI. Now, one quick thing to mention, Clinical Key is a platform by itself, clinicalkey.com, and Clinical Key AI is a separate platform. So if you see here the web URL, it is ai.clinicalkey.com. So it is separate, 2 separate platforms, yeah? Okay, so very quick mention on that. Now, as you can see from this landing page that I have on Clinical Key AI, right now I am signed in. You will see my name here. Okay, so my email address as well, stephanie.chan@elsevier.com. Okay, so once I'm signed in, I'm able to ask a question, right? Now, one different thing as well that we mentioned with Clinical Key is we search by keywords, right? We search heart failure, we search diabetes. We are using keywords. We are not asking a question. When it comes to Clinical Key AI, you can see here from the examples of the clinical questions to ask, what should I do with tacrolimus if a patient is on Paxlovid, for example? So you are asking a question, and that's one of the major differences between Clinical Key and Clinical Key AI. So if I were to start asking a question, and I'm going to use, I'm not a clinician myself, I did my master's in pharmaceutical technology, so I'm slightly more towards the drug formulations and drug discovery side of things. I'm not a clinician myself, but I do have a little bit of a cheat sheet in the sense that I have a question here from one of our clinicians, and I'm just going to copy paste it in. But before that, I'm just going to show you just a very quick, you can ask the most simple questions. For example, what is the, what is, what is an alternative prescription to losartan, for example, the most simple question that I can probably ask, right? I can ask even a simple question like this. And when I click on the ask, so as you can see, it's synthesizing the relevant information. And while it's doing that, I want to, oops, there is somebody who is just joining the, okay, just admit it. I still want to show you where is the content information coming from. As you see, the response is being generated. Okay, now, if you notice, I did a slight typo, right? So I may be a native English speaker, but my spelling is not that great. So one thing we always want to know is when we ask a question, does the AI understand the question? Are we getting the response to the right question? Are we on the same page? So one thing with Clinical Key AI is that it will repeat your question to you, so that if you are using any abbreviations, for example, if you type in DVT, it will expand that into deep vein thrombosis, so that you are able to confirm that the system is understanding your question correctly, right? And one thing we always mention as well, the responses are AI generated without human review. Okay, so please do exercise clinical judgment before applying this information that we have. So as you can see, a simple question that I have asked, the responses, alternative prescription to losartan, for example, you have valsartan and irbesartan, azilsartan as well. And remember, we mentioned for Clinical Key AI, we want to provide you with trusted sources. So everything is referenced, okay? So you will see the hyperlink to the references below, and you will see here that it is coming from Elsevier Clinical Key, our drug class overviews. And this is now going to bring me to the content source that we have. Now, as I said, trusted content sources, right? So you would want to know where this information is coming from. You can go to help and go to how it works and scroll down to the content sources. So in this space, you are able to see where we are referencing our responses from, okay? So we are looking at our clinical key point of care content, which is our clinical overviews, the drug monographs, as well as the drug class overviews. We look at full text journals that are available in by Elsevier, our own Elsevier journals as well, including the clinics series. We have recently added that. We also look at abstracts from curated journals that are copyright cleared for use, and these may be non-Elsevier journals, right? So you do not only have the access to the information coming from Elsevier content, but also non-Elsevier content as well. So you will have information coming from NEJM, BMJ, JAMA, for example, and several other non-Elsevier journals. And this is in a bid for us to avoid biases when it comes to the AI portion of Clinical Key AI. We also have a look at the Lancet and our Elsevier journals as well. We also look at US government publications coming from the FDA, the CDC, and the NLM. We have the guidelines coming from the American College of Cardiology, the ACC. Now, when we first started out with Clinical Key AI, when we first launched in the US, we actually only had 3 books. We had Braunwald's Heart Disease, we had Goldman-Cecil, and we had Nelson's Pediatrics. These were the only 3 books that we have from Clinical Key AI when we first launched. As you can see, we have expanded to, I think, close to around 10 books right now. And we are looking to further expand the content and the content source as well as we speak to different authors and publishers to get their consent and their approval, as well as the copyright clearance for this information to be used in Clinical Key AI. So as you can see, our system is updated. New articles are published when the authors update their existing content. So similar to Clinical Key, we do index Clinical Key AI on a daily basis as well. Now, since I'm here, I do want to mention that Clinical Key AI is intended to be used for clinical information and knowledge discovery. Please do not use this as a calculator, a scoring or staging tool, or to confirm IV compatibility, right? Please also do not include protected health information or any personal, confidential, or sensitive information of your patients within here. Now, that doesn't mean you are not able to contextualize the patient case, right? Just do not put the personal information, okay? So I'm going to use this clinical scenario that we have from one of our clinicians. So I'm going to ask a clinical question now, okay? 58-year-old woman, okay? Let me do a few abbreviations so that I can show you the expansion when we are using abbreviations in this case, right? So a 53-year-old female with type 2 diabetes mellitus diagnosed 10 years earlier. She also has hypertension, she has hyperlipidemia and passive smoking. She presented to the ED complaining of acute onset shortness of breath and feeling lightheaded. Her pulse is 114, her BP is 190/100. So my question is, what are the differential diagnoses, right? I also want to mention here as well is that we have a 350 character limit. So if you are using abbreviations to ensure that you are within that 350, then that's perfectly fine as well, right? So again, if you start running out of characters, for example, shortness of breath, I can then shorten it to SOB, for example. So that saves me a number of characters as well. So I'm just going to ask this question again. We are analyzing the query and then we are retrieving from the sources that we have, which we just covered earlier. And then you will see a response being generated. Okay, now as the response is being generated, again, let me highlight to you that your question is repeated with the abbreviations expanded and in bold so that you can confirm that the CKAI system is understanding your question as you have asked it. So when I type T to the M, I want to make sure that it knows I'm talking about type 2 diabetes mellitus, right? When I shortened it to SOB, it's then expanded to shortness of breath. So this allows you to confirm that the response is being generated based on the question that you're asking, all right? So the response that's being generated here, so it could be acute coronary syndrome, for example, pulmonary embolism, acute heart failure, hypertensive emergency, arrhythmia. So now you have all these different differential diagnosis, right? All these options. How is that going to then bring you to your next question? Again, think of this as a conversation, right? And I've touched on this earlier, the different references. Okay, so if you are looking at pulmonary embolism, for example, and it's coming for our Elsevier clinical key clinical overview, you can look at the details here in the section that is relevant. So in this case, the section that is relevant where we retrieve the information from is the differential diagnosis, right? This is where we are getting. If you want to have a deeper look, you want to read the entire clinical overview, you can click the link and it will bring you to clinical key, right? So I'm being redirected now. It will ask me to sign in. Just give it 1 second for it to log in. And it will bring us into clinical key. We were back at clinical key and it should bring us to the pulmonary embolism clinical overview. And since we were looking at the differential diagnosis, it will automatically bring us to the differential diagnosis section. However, you are still able to see the entire clinical overview and its content within clinical key itself. Okay, so going back to clinical key AI. Now, again, we are talking about this as a conversation, right? We always mention that once you start asking a colleague of yours a question, you might have follow-up questions. Now, the one that I mentioned is that we have these 1, 2, 3, 4, 5 different differential diagnoses. So perhaps we want some assistance to know a follow-up question of perhaps what sorts of lab tests and diagnosis tests that I need to do so that I am able to differentiate between the various probable diagnoses, right? And also I would want to know what is the urgency of this test, right? Which one should I do first? Which one should I prioritize? In this case, it saves you time and it saves you cost as well, so that at least you start doing the tests that are most relevant and the most urgent before you do the secondary tests for this. So let me ask this follow-up question. So which investigations do I perform to differentiate between these differential diagnoses? Okay. Now, as long as you are in the same conversation, okay, the system knows that you are referring to the same patient case. So as you can see, right, it repeats to you that this is a 53-year-old female with type 2 diabetes mellitus, the hypertension, hyperlipidemia, and with the pulse of 114 and blood pressure of 190/100. So you will know that you are still referring to the same patient case in this instance. So to differentiate between ACS, PE, AHF, hypertensive emergency arrhythmia, so it recommends to do an ECG, a chest X-ray, cardiac biomarkers, troponins, D-dimer test, as well as echocardiography. And the references are here as well. And if you do want extended information, there is the additional information here as well that you can see. So the reason for the recommendation of this test is that it is high due to the potential life-threatening nature of the condition involved. So you are able to get quick answers, but also if you need the additional context, there is the additional information here, and anything that you need to do a deeper dive into, the references here, whether it's in the detail section or the relevant, in this case, journal article, you can go directly into the source of the information as well. Now, there are also some cases where you may not have a follow-up question in mind, but we found that a lot of the clinicians that we have spoken to so far, they actually look at some of the follow-up questions that we have. And these are suggested follow-up questions that you can maybe have a look at. So, for example, what are the common complications if it is misdiagnosed or untreated? Okay, so what are certain long-term management strategies that is recommended for PE? For example, this patient has passive smoking, right? So how does the passive smoking influence the progression of heart failure in patients, right? And then maybe of all the different diagnosis options that are given, you may be curious, how effective is echocardiography in detecting early signs of valvular heart disease, for example, right? And maybe, for example, let's see, maybe I can get some help from Dr. O or or all the other doctors in the call. Is there a follow-up question that you would like to ask regarding this patient case? Or would you like me to start a new conversation and type in a question that you have?
So I'm not sure. Actually, my background, I'm the gynecologist. So I'm quite not very familiar
Would you like
with
to ask
the patient with the heart failure.
Yeah, or Dr. O, would you like to ask a question that is, gynecology related? We can always ask a question. No worries.
Sure.
Let me start a new conversation. Yep.
Okay, the new one, right?
Yes.
Okay. So the patient, the female patient, 40 years old, okay, come with the foul smell discharge.
Sorry, with?
Foul smell,
Okay. Okay.
the foul smell discharge.
Okay.
So what is the differential diagnosis? Okay, let's try.
Sure. Oops. Spelling. I'm not good at spelling.
This is very common situation in gynae clinic. Very, very
So,
common.
Yep, it could be bacterial vaginosis, it could be trichomoniasis, it could be mucopurulent cervicitis. Are these three the types of conditions that you might consider when a patient comes in?
Yes. So the follow-up question is so what I have to do next?
Okay.
What is the further investigation?
But
I think the common word is what is the next step, I think.
So yeah, that comes to the point of the prompting, right, Dr. O? So when we talk to each other as as a one person to another, we say, okay, what's the next steps that we would take? However, in the system, when it comes to prompting, we kind of have to nudge it a certain way. So for example, what sort of tests do I do? Or what sort of treatment plan should I come up with? So in this case, we would say what further investigation and tests should I do for this patient, for example.
Let's see.
Give it a second. All right. So as you see, it repeats again, right? The 40-year-old female with the foul-smelling discharge. So it recommends to perform a pelvic examination, to do a vaginal swab as well for gram stain culture, conducting a pH testing, use nucleic acid amplification test, and also maybe a wet mount microscopy to look for clue cells, trichomonads, or yeast cells. So this is taking into consideration a lot of this different testing and where this could lead, right? So maybe in this case,
so
Dr.
I
O?
can I ask more? Okay.
Yes, of course.
For this one, okay, for the KOH test is positive. Okay. KOH is positive. Okay. And clue cell is positive.
And sorry,
the clue cell. The clue cells. The last
the clue cells are positive. Okay.
The clue cell is positive.
Positive.
So what is the diagnosis and what is the treatment?
The diagnosis and recommended treatment, right?
Yes.
Ask this
and
question.
maybe you can. Okay. I think this is
we
enough.
can follow up with a follow-up question.
Okay.
No worries.
Okay.
So this is helpful as well. So once I start asking questions, I have my chat history here, as you can see, right? The questions that we have asked so far. So the test may take 1 or 2 days to come back, or you might have this patient coming back 1 month later when you are monitoring their condition. So you can go back to your chat history and continue the conversation once you have your lab test, once you have your updated patient test results, etc. Okay.
Mm.
So recommended treatment metronidazole, oral dosage of 500 mg twice daily for 7 days. And then clindamycin. So we're using quite a number of the antibacterials. Okay, secnidazole as well. Yep, this sounds very standard when it comes to
Yes, but I can say that the answer is true. Okay, the diagnosis is bacterial vaginosis is right
Okay,
because the
wonderful.
KOH is positive, the cell is positive, and the dose is correct. So I'm very appreciate that.
Wonderful. Thank you so much, Dr. O. And we also, as this is a clinical tool that is being used by clinicians, is the, oh, hang on. I don't have my, oops. Yeah, I don't think I have it. Okay. So yes, as I was saying, you are able to, oops, excuse me. You are able to then look at all the different resources that we have. So as you can see, some is coming from Goldman Cecil, some is coming from the FDA, right? So when we're talking about Solosec, which is secnidazole, you can also see the label via DailyMed or even the details. So this is where it's coming from in terms of the dosing as well as the recommendation for the treatment. And let's say, for example, you know, as I said, you know, if I don't have a follow-up question myself, I may want to look at the follow-up question suggestions, right? So this patient could then be experiencing recurrent vaginal bacterial vaginosis, right? It may not be her first appointment here. So maybe then I would want to look at what are the possible treatment options if this is a recurring case, right?
Yes.
And I can ask this question, I can select the question, and then it will retrieve the sources and generate a response for us. Okay. So generally it's still the same. We're still, we may treat it with oral nitroimidazole instead. So alternatively, you could use a monthly oral metronidazole or combine it with fluconazole as well. So this provides you some treatment alternatives. So you may...
And I think this one is very interesting because they use the lactobacillus is a kind of the prebiotic is in on the research. So I think this is very interesting that this is kind of the recent data that the clinical key AI answer.
Wonderful. And as usual, if you want to look a little bit deeper into the journal, the guideline, or even the information, then you can always click into the link and it will bring you to the question that you have, right? So if maybe not so much on the gynae side of things, is there any other clinician who maybe wants to ask a question in clinical key AI for their specialty? I'm happy to type in as well.
Yes, so please join us. I'm not sure that any people want to try the clinical key AI.
While we wait, maybe they are formulating the question. I sometimes get the questions as well, especially for Asian countries, in terms of whether we are able to use non-English questions. All right, and I just want to show you here, this was a question that I typed for one of our
In from Vietnamese, right?
Yes, in Vietnamese. I also did a very quick one just yesterday with Thai language. So one thing we will, I definitely want to highlight, you can ask the question in Thai language, right? However, and the response will also be in Thai language, but please be very, very, very aware that clinical key AI is an English-based tool, right? So even when we have the local language available, please do read through it very, very carefully. The reason being is that, as you can see, the references that we go to, the FDA, the guidelines, everything is in English, right? So that's the reason, even though we can accept the question and provide a response in Thai language, but our source content is in English. So our recommendation at the end of the day is still to use English as the primary conversational method rather than the local language. And if you do use the local language, please take extra care to read through the information and also check the references as well, right? So we are able to, but you do have to take a certain amount of caution when using the local language.
Mm-hmm.
Okay. I don't think that, oh, let me see. There's a, oh, no, not so much.
Mm-hmm.
I hope it's not too much information suddenly.
And I think last but not least, I would like to speak in Thai. อยากจะให้คุณพัทนะฮะคุณแพทนะคุณแพทนะฮะรบกวนแนะนำตัวเองนิดนึงฮะเผื่อว่าท่านใดอยากลองใช้ Clinical Key AI แล้วกันหรือว่าอยากให้ไปพรีเซนต์นะครับเนาะผมคิดว่ามีคนไทยอยู่หลายท่านทีเดียวนะอยู่ในนี้ครับแนะนำตัวเองนิดนึงครับคุณแพทครับ
พี่แพทเปิดไมค์ก่อนครับ
ค่ะขอบคุณค่ะอาจารย์แพทนะคะจากบริษัท New Knowledge Information ก็ร่วมงานกับคุณชาญวิทย์กับสเตฟานีค่ะแล้วก็ดูแล Clinical Key AI ในประเทศไทยนะคะก็ถ้าอาจารย์ท่านไหนที่ตอนนี้มีประมาณ40ท่านที่ทางเราได้ส่งแบบว่าขอ trial ส่วนตัวไปนะคะมีประมาณ20กว่าท่านที่ activate มาเรียบร้อยแล้วท่านไหนที่ยังไม่ได้ activate ก็อาจจะ activate เพิ่มเติมหรือว่ามีคำถามในเรื่องการ activate ยังไงก็แจ้งแพทได้เลยนะคะแล้วก็ถ้าสมมติว่าท่านไหนอยากจะเปิดทดลองใช้ในรูปแบบสถาบันนะคะอย่างให้ใช้ทางมหาลัยก็ทำได้นะคะก็แจ้งความประสงค์เข้ามาได้เลยค่ะเดี๋ยวแพทจะขออนุญาตพิมพ์อีเมลแล้วก็เบอร์โทรติดต่อของแพทเอาไว้ในช่องแชทบ็อกซ์นะคะก็ฝากติดต่อเข้ามาได้เลยค่ะขอบพระคุณค่ะ
ครับขอบคุณคุณแพทนะฮะ and I think because we are run out of time, Stephanie, thank you for your time. I am very appreciated that your presentation and very, very comprehensive and very useful. I hope we meet you in person in Thailand when we launch the Clinical Key AI in Thailand. Mm-hmm.
I would love to. Kun Pat, please ask me to go to Thailand too.
Okay. Thank you.
All right. Thank you so much, everyone, for your time.
ขอบคุณมากครับ
ขอบพระคุณค่ะ
สวัสดี
ขอบพระคุณทุก
รับ
ท่านนะคะแพทส่งคอนแทคไว้ในแชทบ็อกซ์แล้วนะคะสวัสดีค่ะ
สวัสดีครับสวัสดีทุกท่านครับ
สวัสดีครับ
บายสเตฟานีบายพิชันวิทย์สวัสดีครับ
สวัสดีครับ